It makes a lot more sense in vaccinating everyone you can and then vaccinating the second dose when you get it, because that's how we end up saving lives.
Increasingly, more health experts are urging leaders not to follow the directions on COVID vaccines. In an effort to get more shots in arms, some provinces are extending the wait period for the second dose.
If we have 2 people, do we give the vaccine to 2 people and give them, greater than 90% effectiveness, or give one person who gets maybe 95% and the other person gets 0? Where's the equity in that?
The practice is in response to slower than expected vaccine deliveries. Some provinces like Quebec, Manitoba, BC and Newfoundland extending the wait time for a second dose by up to 4 months, a move defying recommendations by drug manufacturers. But experts say those recommendations are based on limited testing.
The reason why it's 3 weeks and 4 weeks is because that's the testing that they did, but it doesn't mean necessarily that you couldn't have it at 6 weeks or 8 weeks.
Banerjee says the first COVID-19 vaccine given to a patient is meant to develop an immunity, while the second, or booster, acts as a reminder to the body of how to kill the virus. Waiting too long for the second, creating risks for the patient and vaccine supply.
At what point would that booster not be considered on time? And the normal public health practice is that you start again at shot 1 and then you do the booster. So that is the risk that perhaps that first shot is wasted.
While more provinces are looking at the practice as a possible way of speeding up herd immunity, the issue addressed by the Prime Minister, who stopped shy of endorsing it.
Obviously, we're seeing some of the science shift, some proposals put forward, which are very, very interesting, which could result in rapider timelines. But every step of the way, we're going to be informed by the experts, by science.
Late Wednesday afternoon, the National Committee on Immunization, following the advice of the experts, recommending extending the period between shots. According to the latest Health Canada numbers, 2.86% of the Canadian population has received at least 1 dose of a vaccine. In Ottawa, Nigel Newlove, City News.